Okay.
Welcome everyone to the webinar with Dr. David Fawcett. I'm Tami. I'm not usually here on Wednesday nights, but my colleague Scott, who is on a well-deserved vacation. So I have the pleasure of working with Dr. David. We work together for Seeking Integrity Los Angeles treatment program, but I rarely get the opportunity to do webinars with him. So I always welcome the opportunity, except for with his topic for tonight, but it's okay. So for those of you that are, no, it's a good one. For those of you that are joining us, you can ask questions at the bottom of the screen. You'll see the Q&A. You can ask anonymously as an anonymous attendee. So if it would be helpful for us to know, like if you're the addict, if you're the partner, if there's some context that would be useful for us to understand, like length of time since discovery, et cetera, please include that. We'll do our best to answer your questions in the order that they are presented, but it helps me if you put them in the Q&A so that I can be somewhat organized. My ADHD gets a little crazy otherwise. So anyway, so I'm going to mute and I'm going to turn it over to you, Dr. David.
Hey, hi everybody, welcome. Always glad to be here and always glad to work with Tami. It's always a nice pleasure. I didn't have a chance to do my shameless self-plug for my book, which I will right now. The sex and we normally do it here. It's called Lust, Men, and Meth: Gay Men's Guide to Sex and Recovery. With my Zoom background, it's really hard to see, but you'll have to trust that it exists. Yeah.
And talk about the new book you're like, talk about the other one too, please.
So Lust, Men, and Meth was based on about 10 years of work that I've done with gay men, working with amphetamines and sex, and how those two become combined into a sexualized drug use. About 80% of the book is applicable to everybody, although the case studies are all gay men. And so I am in the final throes of a book that really looks at the idea of sexualized drug use, or this co-occurring drug use and sex among all populations, men, women, gay, straight, and with all drugs, because it's not just amphetamines and sex. We see marijuana and sex, we see alcohol and sex, we see different kinds of drugs in porn. So all of these things can combine in different ways. And I think it's really important to get this message out that I believe, and it's really borne out now, I think increasingly, that when you take a drug addiction and combine it with a sex addiction, you have a whole third new thing. Those two addictions fuse into this whole other animal that really requires specialized treatment. And we're one of the few places in the country that do that. So the book will be about that. So thanks, Tami, for the reminder. Appreciate it. So tonight, I just realized, I think the last time Tami guest hosted, this is her favorite topic. I did it again just for her, but the topic is patience. And so, hi, now she just rolled her eyes. So patience and recovery. And what does that even look like? What is that? Why do we need it? We're all kind of, let's get on with it kind of people. And so I think we have to kind of understand what's going on. And to do that, we have to start back in the source of all our woes, which is our brain. When we are in addiction, we are really living out of our midbrain, the middle part of our brain that is really in overstimulation mode. And especially when we talk about sex and porn addiction or chemsex, which are all intensity addictions, which all just jack it up even higher. So this midbrain is literally on fire, sending out these high intensity impulses saying, I want more, I want more. And we kind of succumb to that. And over time, one of the changes that happens in the brain is that the neural pathways that connect the different parts of the brain kind of get frayed and thin. And one of the main kind of super highways of information between this emotional, on fire, overstimulated part of our brain, the midbrain, normally we should have good connection with the prefrontal cortex, which is where our impulse control lives, which is the sort of the adult in the room that would say, wait a minute, I know you want to go out and do this, but that really wouldn't end so well, right? All that part of our brain that helps us control those impulses kind of goes offline. So we're at the mercy of these high intensity cues. And by the way, this happens with porn, sex, and chemsex. You can be well into your recovery. I've had clients 8 months, 9 months, a year, doing great, not even thinking about it. And out of the blue, somewhere they'll get a text message, they'll get triggered, something will happen that kind of reignites this urge for the addiction. And when those, I call them landmines, they kind of just explode again. And so there's this person not even looking for trouble, and a text message comes in, and boom, it's all they can think about. They're totally hijacked. And that is the strength of these urges and these cues and triggers when they light up. So we really, really need tools to push back. And in early recovery, because that prefrontal cortex is kind of offline, we don't have much ability to have a braking system to say, no, 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 or to have impulse control. And so one of the tools we can do, and actually useful to develop for all kinds of recovery principles, is patience, learning how to have patience. And patience is really this kind of soothing counterforce to the brain that's on fire. And so what is patience or impatience? Impatience is this urge for instant gratification. And if there's anything that really summarizes what that addictive cue is, when we get triggered to act out, we want that right now. And we want it, faster than fast. So that instant gratification really becomes more powerful in our brains than things like empathy, patience, knowing this is the wrong thing to do, knowing this is going to hurt people we love. All that kind of fades into the background, and it's not as bright or as powerful, literally, as these impulses. So patience is one of those things when we are in the throes of an addiction, which is requiring more and more intensity. Patience really helps us kind of calm it down. And so and the other thing too, by the way, when we're feeling so distressed and intensity, if we don't act on it, we start to get even more anxious. So it gets very, very uncomfortable if we don't address it. So why? Why do we need patience? We need to calm down our brain, right? First of all, to cool it off. That helps that process. But it's also necessary to help us, the addict in recovery, accept our own shortcomings. How many of us just wanted to get through this, get it done, let's move on with it, and just didn't have the patience for this very slow unfolding of recovery? It's hard work, it's painful, it's emotionally upsetting, and it's slow. And it's slow that this frustrates, I think, our partners, it frustrates us. And I think that's where patience is even more important. So patience with ourselves, right? It can be very, very difficult to start to forgive ourselves, right? We talk at Seeking Integrity about addicts being good people who did bad things. And I totally believe that. But to change that wiring in our heads and our beliefs about ourselves and what we do and how to respond to things, and really it requires a transition of almost every way we live, how we handle stress, how we respond to different kinds of pressure, how we ask for our needs to be met, how we know what our needs are, how we know what our feelings are. We were kind of joking this morning with some clients at Seeking Integrity about feelings, and we have these little emoji sheets that people really need those sometimes to figure out what they're feeling, because certainly when I was in early recovery, I just felt bad. I didn't have a vocabulary for anything else. And so it's a long, slow thing, and patience really helps with that. But patience is also necessary for making these valuable life changes that we need to make, right? We need to have patience with ourselves. We need to have patience and faith that if we take the right steps, we'll increase the chances of our relationships maybe working out. But those take time. We talk about both the addict and the betrayed partner being on roller coasters, and that happens for a while. Moods are up, moods are down. The problem is you're not on the same roller coaster. So the partner may be up, the addict is down, and vice versa, and that up and down goes on for a long time. And so patience for that process as well, patience for the healing. So all these things are just really important to and allow us to have a symptom-free recovery eventually. So this endless process of recovery with self-awareness, with self-control, with growth, all that requires this ability to defer our need for instant gratification from those cues. Later, it may be not so much the impulse to go use or act out or look at porn or whatever our addiction is, but it may be just having patience with the process of healing, which can be slow, and it can be 2 steps forward and 1 step back, and we can get upset. And one of the things I found in my early recovery is that life goes on. I didn't get a pass on life events just because I was in recovery. And in my first couple of years of recovery, I had some critical family things that happened that I had to deal with and had to be present for and show up for. So all that takes patience. So by the way, I will say one other thing before I get into a few strategies. Boredom. We always talk about with these intensity addictions how boredom can be a real trigger. I think patience really helps counteract that inability to tolerate space that's kind of open. If we have an hour How nice to just have some downtime instead of being impatient and needing to fill it up with activity. So a couple things to do, just strategies. And this is, I talk about mindfulness a lot. And mindfulness is really just being aware of what we're feeling, what we're seeing, without judging it, just kind of being aware. So I think things like waiting in line, which sounds really tedious, and it's very frustrating. But the whole act, if we can approach even standing in line as kind of a mindfulness meditation, just learn to be patient, learn to sit with our feelings, turn it over. We're powerless for that. Working for a later reward, we want that instant gratification. So the ability to break some big long-term project down into steps and do the first thing and then the second thing and the third thing and build toward something that takes time. I think all of us kind of want to do it fast and get it done right now. Following recovery guidelines. How many times does a sponsor say to just slow down, or we'll do this? There's a sequence to things, right? The steps have a certain brilliance in how they're laid out. And for example, we don't have an amend step, up front. That's quite a ways down after a lot of self-work has happened, and that's for a reason, right? That's based on a lot of logic and wisdom. And so I think we might be wanting to fix our relationships right up front, and we don't have the patience to let those kind of sit and heal in an organic kind of way. So all these things really help us start to learn to slow down those impulses from that big brain I started talking about, and help us to really kind of deal with that. So other recovery activities, attending meetings helps us remember where we've been, helps us remember why we're here. It helps me remember that I belong somewhere. I was sharing earlier with our clients that, when I first got into recovery for the first time in my life, I felt like I belonged in a room full of people. And I still have that decades later into recovery. I can go to California or Paris or Hong Kong and walk into a meeting, and I know that I belong there, even if it's not in English. And so that's an amazing feeling, and one of the gifts of recovery that I didn't really expect. Another thing, exercise. We talk about how exercise is really important. Exercise, as a byproduct of exercise, gives off these amino acids that help rebuild the neural circuitry in our brain that's damaged by addiction. So if we start to look at exercise as a way of managing stress over the long haul, as opposed to maybe how it's going to make us look, but just really looking at slow, steady gains. Exercise is another way where we can really apply that patience. Future goals. Things like I went back to school when I got into recovery after a couple of years. I decided I wanted to be a therapist, and that's not an overnight thing. So I was working full time. I was going to school at night. It was a slow process, but it probably was the single most significant thing that taught me how to take things slowly with patience, step by step, in a way that I never had been able to do before I got into recovery. Other things, and then I'll close, breathing techniques. We talk here a lot about 4-7-8 breathing, just a way to interrupt that cycle when our midbrain gets agitated, when we need to when they're going to crawl out of our skin sometimes. That 4-7-8 breathing, which is simply, if we have a picture of metronome beating steady beats, we inhale for 4, we hold for 7, and we release for 8. And if we can do that just 4 or 5 cycles, it really calms down our physiology. And then different ways of relaxation. And finally, if none of those tricks work for me, what still works to help me find patience is the serenity prayer. Just really, okay, let's put this in perspective. What do I have power to change? What do I need to accept? And how can I tell the difference? And that's really the key. So that's my little sermonette on patience. Thank you, Tami, for bearing with me on that.
Well,
And,
I have to say, there's a lot of, I've made tons of progress, but something that happened with me between the last time we talked about this was I was talking to a friend, and I'm quick to express that I have no patience. And she looked at me and she said, you do. You just need to cultivate it. And I thought of and I talked about resiliency at one point, because I thought you either are resilient or you're not. And you were sharing, no, you build resilience. And so it was one of those I had to go, oh, wait, because it's an easy dismissive thing for me to do is oh, I'm just not patient, and then I get a pass. And that's not the case. But I laughed because you were talking about go stand in line. And back in the olden days when you would stand in line for things, my original sponsors were go pick the longest line, I mean, like torture, go pick the longest
That's
line.
great.
Like, yeah. And just be okay. Now, this happened the other day. So I have tons of room for improvement, but my husband and I were driving from the grocery store home. He's driving and I'm sitting, this is a setup for not good. So of course a car gets in front of us and goes slowly, and my immediate reaction, and it's a reaction, is, ugh, and I had to verbalize to my husband that, like, I hate that I react. It doesn't matter. It's COVID-ish yet. We still don't go everywhere. Does it matter if I get home a minute later? No, I still have to go through that mental energy of backing myself off. But the mindfulness that you're sharing is like, and there's lots of times I can be more patient. Apparently cars and driving is still an issue. But, and I will get behind more, slow cars and things, and it just doesn't matter. And what I really hate is I'm letting it negatively impact my serenity. And I find my serenity so precious that it blows my mind that I'm willing to give that up to a anonymous driver in front of me. I mean, so I have this awareness, and I'm really working hard on knowing that I have patience, practicing my patience so that I get a bigger patience muscle,
Mm-hmm.
But the breathing and the serenity prayer, go-tos for me to calm myself down and just refocus and things, those have been super helpful, but it didn't come naturally. It still doesn't come naturally, but I'm still willing. Like at this point, I still want more of it. I want to be better at it. I still want to improve in my recovery. So there's no coincidence that this is the topic for tonight. So
Good.
So the next, or we have a question. We have several. So the first question is, what are intrusive thoughts and what are the causes and symptoms of it? How to know if you suffer from it and any tools to help with it? That's a great question. Intrusive thoughts. I mean, I know a lot of addicts, particularly sex and porn addicts, struggle with the intrusive thoughts. So,
Right. So intrusive thoughts can have a couple different sources. One can be what I was talking about tonight, when that midbrain is kind of inflamed and we're kind of obsessive about something. We can't get rid of it and it keeps going on in our head. And when we have those powerful intensity addictions, the cues for sex and porn and chemsex especially, those really get strong and they can kind of keep coming back. And very often early recovery, especially, we have to kind of keep giving away. I've told my clients, so you give it away, you kind of recenter yourself, it'll come back a second later. I've had days in my own early recovery when I would, just kind of have to refocus time after time after time, multiple times a day, because my brain would get temporarily hijacked. I had to kind of bring it back to center. So that's one kind of intrusive thoughts. The other kind that when we hear the term intrusive thoughts more classically is as a symptom of trauma, and specifically post-traumatic stress. There are 4 different criteria for PTSD, but that's definitely one of them. And intrusive thought is literally, driving home from the grocery store and suddenly there's a thought in your head of some trauma. It could be abuse, it could be an accident in the past, it could be a near-death experience of some kind, it could be some kind of abuse, trauma, all kinds of different things. And that really is a symptom of unresolved trauma. And I'd say in the past 10 years, our trauma therapies have gotten so good. They're not perfect, but they're really, really good. And there's a lot of different modalities that can be used to manage those intrusive thoughts, because that's really a symptom. Something's not quite right. And it could be the midbrain, firing up with addiction. It could be PTSD. It can also be something like ADHD, frankly, and or mania. So there's a lot of different things that could go on, but intrusive thoughts aren't normal, right? They could be normal for some people, but it's not something you want to go around. They're very unpleasant, obviously. And so to me, they're a symptom that there's something that might be able to be corrected. So I would definitely get it checked out. But if I see somebody complaining of that, the first thing I would think of is probably PTSD.
Well, and I was thinking about this, and actually something you said earlier with patients being triggered, and I thought of that for betrayed partners, because when they have discovery, it comes at them, it's traumatic, and often I hear the intrusive thoughts. Sometimes because they discovered and have too much, like, so now it's stuck in their heads that they have a visual of it. Sometimes because the addict unfortunately shares like gory details, and so then they get stuck on that. So I was really thinking from a trauma standpoint that that unfortunately, when I'm talking to some partners, they are sharing, like they really are stuck, like almost immobilized. So I love that you're sharing there's trauma therapy. It's not normal. It doesn't mean you're pathologized. It's just like there's help, and you need to get some qualified support. Even when you're talking about ADHD or the manic, like then get the psychiatric evaluation, because there's help for that in a different way. So getting the right
Exactly.
help, the qualified help can not magically make it all better, but really put you in a different place.
Right. And just to back up, what is trauma, right? Trauma is when we get an event or information that overloads our ability to handle it, basically, literally. And so this stuff kind of gets stuck in our brain and that can't get processed. Normally, an event would kind of get stripped down and deconstructed with, the different memories being filed in different parts of the brain. When there's traumatic experience, it just gets stuck there. It's not processed, which is why years later, if you don't get treatment, if something reminds you of it, it all lights up as if it's happening right now. And so, yeah, when you hear those details like that, and in that scenario with a partner having discovery or hearing these things, that's why we're so careful with how disclosure is formatted, by the way. But if it doesn't happen appropriately, yeah, of course, those are things that can't be unseen. And just like a bad car accident, right? It's the same thing. It gets in our brain. We have to be able to kind of process that. And there are ways to handle that. There are ways.
I'm going to tag onto what you're saying about disclosure, because I get partners that say, I want to know everything. I need to know everything. And I'm like, no, you're asking for a car accident. You're asking for that trauma, and you deserve to have disclosure, but you deserve to have it in a loving and caring way, with a qualified person. Not that, it's hard anyway, but you deserve to have it in a way that isn't going to be like you got hit by a truck. So I think it's really important to know it's challenging anyway. Make sure you're setting it up for you to have the best experience. So
yeah, for sure.
Next question: what is maladaptive daydreaming? What are its causes and symptoms? Does it have a role to play in addiction?
Great question. So I guess this begs the question: is any daydreaming not maladaptive? So the human mind does. It's kind of wired to go into two different modes, right? We have this sort of aware, sitting here, focused mode, and then we have this sort of reflective mode that can go into, and we call that daydreaming. We also call it dissociation. It's a way to disconnect from what's going on. And I use the example of, if I'm in Florida, we have this huge, long 200-mile turnpike that goes from where I live to Orlando in the middle of the state. It's like the world's most boring scenery. Arizona, I know, has very similar roads. I've driven them, where you can see the next 100 miles ahead of you. Driving that road, almost inevitably, I'll kind of start to daydream. And suddenly I'm 60 miles down the road, and I don't remember what happened. I've been driving, I've been passing, been slowing down, been operating the car, but it's like I've been gone, I'm absent. That's really what daydreaming is. And when it can be maladaptive, I would say, is when, and everybody daydreams, by the way, we all do, that's just part of normal life. But when we start to spend excess time in those daydreams, when we start to disconnect, that's when it becomes what I would call maladaptive. And that has its roots also in trauma, where a kid, if you think about it, if there's some adverse situation, abuse, neglect, even a sibling who's sick and that gets all the attention, anything that kind of makes the household unusual, one of the only escapes the kid has to not check out or defend themselves, or to protect themselves, is to check out. So I'll use an example of myself. As a kid, I didn't want to be in the family I was in, and I did a lot of reading, I did a lot of music, and I did a lot of daydreaming. So I was a pro at dissociating, at disconnecting from myself. And when I found alcohol at 12 or 13 or whatever, it was amazing, because I already knew how to dissociate. It was a drug that could power that for me. And so I think that's what I would call maladaptive daydreaming. I would say maladaptive dissociation, which is really disconnecting. And it's a way of protecting ourselves. And For example, if you get bad, disastrous medical news, right? It's very hard to absorb that all at once. It's overwhelming. And so a lot of times people will dissociate, they'll check out. And it's a safety valve. It buys us time to process bad news, basically. The problem is we can get stuck in that checked out state. And most addicts, myself included, when I was active, really sought that other realm as kind of where I preferred to live rather than in my own life with all the problems and emotions and pain and other people that complicated it. It was so much easier in my own little space where I had total control. And that, by the way, it's obvious, a setup for porn or sex addiction or any kind of fantasy-based gaming. Yeah, thank you. We're on the same page. Gaming, even gambling. So yeah, it really sets us up. So yes, so it definitely has a role to play. I think it's the kind of precursor for active addiction, that the skill and sort of, I guess, seeing the benefits of dissociating is what I call
it. Well, and to combat that, some of the techniques we talked about, like the breathing exercises, mindfulness, grounding exercises help, not snap us out of it, but sort of, it's like, if I'm sitting here and I'm thinking about my feet being on the ground, I'm mindful of that. I'm paying attention to that, not, often, some other realm, so to speak. And, and I think, like you're saying, we all need that. We all do that to a degree, just like I need a mental health break and, check out a little bit. But, we've had clients before too, where like it was a problem, the level of dissociation, anything uncomfortable, and they want to, go off to that safe place. It makes it challenging to handle the reality of recovery.
We had this conversation actually earlier today in the unit. And I go for it. What is the intention? If I'm, I don't know, planning a wonderful vacation, so yeah, it's natural to kind of dream about the city I want to go to or what I might want to see, and that's all kind of fun, and there's nothing pathological about that. But if I'm feeling depressed or feeling overwhelmed, or and I decide to kind of drop into that fantasy space to soothe myself or to get away from yucky feelings, that's the wrong intention from my point of view. Just an easy way to distinguish.
And I think for addicts, we have to learn to live in reality. I mean, that was what we didn't do well. So,
Tami, come on.
No, but it really is. It's like reality is for those of us that that chose addictive behaviors, whatever they were, whatever form it was. I have to always check my motives, like you're talking about. So.
Right.
Okay, so to me, patience looks like meditation and more pauses rather than working through my work break or eating the second or third bowl of ice cream. I can still work on eating less ice cream, but I pause more and eat less. It's so hard to stop playing whack-a-mole with addiction and substitution of one addiction for another. How do we deal with patience towards minor cross addictions? I still deal with food and shopping addictions, but before I was a sex addict and major codependent, which we don't even use that word, how do I stop judging the minor addictions? It's hard being non-judgmental. I just want to be perfect already. Good luck with that. I haven't found that, and I've been trying. I don't even try to be perfect. So LOL, basically, I just want to know more about being non-judgmental. So this is a great share, and thank you for sharing, and yeah, it's like all of these, well, I call it kind of the garbage can. It's like, well, if I can't get to that, I'm going to do this or this, I'm so busy looking for, what's going to take me out of the moment. So your thoughts, Dr. David?
Yeah, it's a great question, because I think this is something in recovery we wrestle with a lot. So if I'm an alcoholic in recovery, what does it mean to start eating too much ice cream or too much pasta or gambling or whatever we might do? And in many cases, I think we kind of do this twisted like harm reduction thing. Well, it's not as bad as, and when I finally got sober, I'd quit smoking, thinking that was the real problem because I didn't want to give up alcohol. But I finally faced alcohol, and I started smoking again, saying, screw it, I need something, right? And I have to quit after my first year. So it's very common. But I think if we have any And there's nothing wrong with ice cream inherently, right? There's nothing wrong with any of these things. But if, again, what's our intention? Is our intention to kind of check out a little bit, or to soothe ourselves, or to somehow use those substances or behaviors to control our emotions? That's where I think gets problematic. And although, yeah, you know, is a bowl of ice cream as bad as methamphetamine? No, it's not. But I think as long as I have those little active addictions kind of in my life, they're just little smoldering things, right? But it's still keeping me from really learning how to manage my feelings. And it may be that I give this, okay, a bowl of ice cream, that's great. But then I stop, like you kind of say, learning patience to slow it down. So there are different ways to do this and really savor it. And I know that's a standard thing with food addiction, where we really taste the food and remember that it takes 20 minutes to feel full and all those things. But I really want to be cautious about these so-called minor addictions, because one of the things we talk about a lot is that, and you use the word whack-a-mole, you know, I've seen so many people get their cocaine addiction under control and become a porn addict, get their porn addiction under control and step up their alcohol use. And we just, unless we deal with what's underneath, we're just playing whack-a-mole. We're treating the symptom. And what's underneath, as I've said before, I think is trauma. And until we really address that so far. So you said basically, I just want to know more of being non-judgmental. That's really a key element of mindfulness, and it's hard and it takes patience. I think patience is not disconnected from this process, because we're all judgmental, and probably most judgmental on ourselves. And so that ability to be non-judgmental, and for me at least, being judgmental of myself is like an automatic response. I have to sort of consciously reverse it. I have to back out of that and kind of still. And so I think we're hardwired in many ways that are very resistant to change. But I think just persistence, patience, and practice. But I really commend your awareness about these other things. But I just be really cautious about giving yourself too much of a pass, because I've seen those minor addictions blow up into something really bad.
We talk about smoking and vaping, we don't permit it at the Seeking Integrity Treatment Program. I was talking to somebody earlier today about that, but I was sharing, because you'd shared before, is, you know, that keeps that dopamine drip going, and, you know, people are more likely to relapse. And I think it is really, you know, oh, well, whatever. But I think the slowing it down, being mindful, I have, you know, well, I'm in recovery from an eating disorder, among other things. But, you know, that was so hard for me. And to not go into the shame and everything, you know, but if I'm having ice cream, it's portion control. I have a small bowl and I'm going to enjoy every single bite of that. I have to be mindful of it, because otherwise it's like driving down the road and being 60 miles down the road. You know, I could eat this and not even remember eating it. I used to call that food amnesia, because I could do that with dessert. I would have like dessert at lunchtime and then completely forget that I had dessert today. And so then I deserve another dessert at night. I mean, like it's just where my brain went with stuff. Sugar, you know, is a really challenging one for me. But I think it's really one of those things. I did it with shopping too. There was one time I was really struggling with something and I bought a purse, and I kept that purse, but it was still one of those, I would not have bought that purse if I wasn't in an agitated, you know, I was looking for something outside of me to soothe me. Now, it didn't break the bank. I wasn't in financial, but I've kept that purse as a reminder of, you know, like, I have to be intentional. It's always, I have to be so darn intentional. Do I need a new purse? Do I want a new purse? Whatever, fine. But, you know, it's one of those where, what is my motivation? And if it's just to shop and have a whatever, you know, that's one thing. If it's because I am feeling like there's a wound and a hole in here, and I think that purse is going to make me feel better, it doesn't ever work. And so, but I love that you're looking at all of these things, and as far as being judgmental, you're like, this is a process, and so be kind to yourself on that level. I'm thrilled that you're asking the questions and you're looking at all of this. And maybe it's like, okay, this week, just pick one thing, and this week I'm just going to pick working on this, and then the next week I'll pick working on whatever. You know, talk to your sponsor. What do you need in a support way to just feel good about the choices you're making? At the end of the day, it's not judgment, you know, of anybody else. It's, you know, I want you to feel good about you, and you're not always going to. There are days I major messed up today, and first thing was, oh, I'm such an idiot. And I had to stop myself and go, nope, you are human and you made a mistake and you're going to go clean it up, But man, it's just, I hate that the first thing I think of is, fail. No.
Yeah. I'd say one more thing about that question is that it's really important, I think, to go back and really be aware of feelings. What emotion are you feeling before you have the urge to eat that bowl of ice cream, right? It's probably not random. So that's a great way to start to put together what's going on and how you're dealing with it. And then you have a choice of dealing with it in a more healthy way. So yeah, that awareness is really key.
So Harriet Hunter did a webinar with us on journaling, and one of the best, there's research on this, one of the best ways to process those feelings is journaling, and it's just for you. You don't have to show it to anybody, or you can show it to your sponsor or therapist, but I bet you would get some really good insights on how you're feeling. If you, maybe before you have the ice cream, you journal, maybe before you shop, you journal, and just kind of, and I bet you'd go, oh, that's what I'm feeling. I'm still going to go have that bowl of ice cream and I'm going to really enjoy it, but now I don't have to look for the emotional whatever. So
yeah, great.
Okay. What is a functional addict, and if there exists one? Is this a concept, just a misnomer? Does it have a scientific basis for it, like genetic basis for it? So,
yeah, I think the idea of, or the concept of a functional addict is really more a creation of an addict in denial. I worked with a lot of guys that are, I'm thinking of these chronic meth users who are in really high-powered, like financial jobs, and even I've had doctors and other people that really thought they were functioning well, and they knew just how much to take, and they were fine. Just gives them a little boost for the day, and this kind of micromanagement of their moods on a minute-to-minute basis. And in general, I think they were just really in a lot of denial. I think once somebody crosses that line and becomes an addict, yeah, maybe they were functional to a point, but I think it's really, it is a misnomer, I would say. I was really pretty much a falling down drunk, but my denial system was that I never missed a day of work. So that was, I clung to that for years. Now, when I was at work, I wasn't very functional, I'm sure, but that's what I told myself. And I would have called myself a functional addict, but I wasn't. So I think it's really just kind of a little bit of self-deception to do that, and frankly, dangerous self-deception, because that, denial, of course, is a classic hallmark of addiction, and people can be really near death in their addictive process and still think they're pulling it off. And so I think it's a really dangerous and really slippery slope. In terms of the literature, there's really nothing out there that talks about that as a real concept that I know of. In terms of any kind of difference between a functional addict and an addict. There's certainly no blood test for it or anything like that.
Yeah, I'm with you. I always went to work, blah, 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 but and it was, I was functional until I wasn't, and I landed in treatment.
Exactly.
So the day before I landed in treatment, I would have said I was functional. So but then there's a really negative, and we hear this all the time of people who, I had a call this week from somebody who was, I called you a few months ago, and everything's worse now than it was a few months ago. And you start talking about treatment, and well, it's not that bad, so it's that whole, situation of, and I'm confident he'll hopefully he gets a chance to call again in a few months, and we'll see. But so the denial comes to mind. So here's a good question. Do serial cheaters have the same recovery process as an SA? Is there a true difference between the two?
Great question. So I think every sex addict has some things in common, including those that are serial cheaters and those that are not. One is just a basic addictive process, which has a life of its own, right? And once it catches on, it rolls forward. But also, we talk about sex addicts having an intimacy disorder or attachment disorder. And that means that they have trouble really forming, I guess, healthy long-term relationships or attachments with other people that are functional, basically. And there's different styles of attachment that people can look at. But I think when I hear a serial cheater, I think they just have particularly more wounds, what I call more attachment wounds. They're harder to connect. And by the way, every addict, but especially sex addicts, has issues with trust and vulnerability and authenticity and all those things that make them vulnerable, which they learned early on, probably out of life and death survival, that it was not safe to be vulnerable and to trust because your needs wouldn't be met or you would be hurt. And so people early on learned how to kind of take care of themselves and not make themselves vulnerable and take care of their own needs. And I think serial cheaters probably have more significant attachment wounds. It's just harder and harder to relate, or more ego to kind of feed with different, because a lot of these guys look for validation as well. And so I think there's some differences in the level of wounding, maybe the degree of work to be done for healing, but I think it's basically the same underlying profile. It's just different. It's manifests itself in different ways. Some guys go more toward fantasy and not acting out per se. Others need that constant repetition of acting out, but it's all really the same. It's different expressions of the same underlying disorder, which is an addiction combined with these attachment wounds and this different patterns of how we connect with other people. And by the way, so we're speaking of patience, that the healing of that takes patience. It takes a while to get through those things.
Yeah, and I think regardless of the labels, so to speak, the wounding to partners is, I mean, you are betrayed, and if we look at the acting out behavior, regardless of it's serial cheating or sex addiction, porn addiction, there's the intimacy disorder. We're really looking in treatment at what are the underlying issues, like you were talking about. There's deep wounding, because otherwise it's whack-a-mole and it switches to something else. But at the end of the day, this is, I'm sure, a chronic condition that will just continue and wreak havoc on everyone's lives unless there's qualified help to change things. So okay, next question. I have read research on playing Tetris daily helps addiction cravings. Is this accurate? Is this because it's an addiction substitute?
Oh, interesting. I don't know the research, but I have some thoughts. I think when we're talking about cravings and those addictive impulses that I was speaking of earlier that kind of stem from our brain, one of the techniques to deal with that is distraction. And if we can distract ourselves, and we can do that in healthy ways by calling, reaching out to somebody, a recovering person or a sponsor or a therapist or a friend, or taking action, we can get up and move our bodies to some other place that's not safe. We can do something about it. I think and this is just my theory, but I think playing something like that really takes the attention off feeling miserable and feeling the need for relief and the craving part of it, and focuses our brain on something that we can actively do. The way human brains are wired, we can't just say, don't do something, right? We'll just think about what we're not supposed to do. All the focus goes there. But instead, it's much more productive to say, okay, yeah, don't do that, but instead do this. And if we can direct it toward a positive thing, that's much more beneficial. And so I think playing a game like this it's engaging, which you want. It's distracting. And I think it's, in a way, it's kind of almost a mindfulness exercise. And we're playing a game like that. We're right here in the present. We have to use our brain. And for everything that all the public or popular theory about multitasking, there is no such thing as multitasking. We can't do it. The human brain doesn't do it. What it does is what's called rapid switching. So I can be talking to Tami, then I can go over here and do a keyboard, and then I can go over there and do that. And I'm just switching very rapidly between the two. But I'm not actually talking to Tami and typing a letter at the same time. It can't be done. And so if we're in the middle of a strong addiction craving, if I can distract myself with something that's very engaging, it's going to pull me away, and it's going to buy time. And what I think I like the concept of circuit breakers for these different addictive impulses. I think the more stuff I can put between me and acting out, if should I get triggered, the better. So if I'm going to make a call, I can do this action, I can do that action, I can say this prayer, I can, whatever. It just slows it down. I think it's the equivalent of, people freezing their credit cards in a block of ice, right? When they have that impulse to buy, they have to melt the ice before they can do it. Hopefully, by the time the ice is melted, the impulse is gone. And I think it's the same theory with a lot of cravings. If we can just distract ourselves, the cravings will pass. They just take some time to do it.
So with this one, I'm not familiar with that particular game, but would you see this as like would there be a time limit, say like 15, 20 minutes, say, so that you put like, would you need to put some sort of boundary on like, okay, I'm taking a mental health break, I'm gonna go play Tetris, but like I can't spend 6 hours playing Tetris, I mean, so what are your thoughts on that?
Yeah, I think that's a really good idea to contain it somehow. And because we are, we can classically, as addicts, drop into that fantasy mode we were talking about earlier for hours and hours. We had a client last week that one of his kind of ways he fed himself literally was reading. He loved to read. Great, who can talk about reading? The problem, he would read for 8 hours. He would just like shut the door on his family and his wife and his problems and escape. So again, it's what's the intention? Is the intention to distract ourselves and give our shift gears for our brain and be in a different space, or is it just check out? And so, yeah, I think to prevent that, I think putting a time limit is a really good idea.
Okay, so next question. My SA partner just started the sex addiction 101 level 1 this past Monday. It's been a year and a half since discovery. I've been getting help for months. Good for you. He has been stuck in shame the whole time, and in his words, can't handle looking back at his actions. How do addicts deal with the shame, and at what point in the process does shame start to subside?
Wow. Well, good for you both. And just for people that know what that's referring to, we offer now 3 levels of Sex Addiction 101. There's 6 90-minute classes taught by Scott and Jason on our staff, and they're really popular, really good stuff. So that's what he's attending. So shame. Shame is really a central feature of addiction, but especially for sex addiction, because there's so much shame and stigma around sex anyway. People just feel overwhelmed with it sometimes. And we do see addicts experiencing something called the shame spiral, where they just hook onto this shame, and they start to have shame about being shamed, and just it starts to get worse and worse and worse, and they drop down into this kind of pit that really is a place of hopelessness and despair and shame. And just there's words a lot of my clients over the years have mentioned that I think just capture it so much. It's like, I feel like damaged goods. I'm spoiled, basically. There's nothing good about me, and just I'm the worst of worst. And by the way, as good addicts, we can take that and really run with it. It's like, no one is as bad as I am. I'm terrible. Our colleague Karen calls that junkie pride, where it's like, well, you think that was bad. Well, I overdosed this time, whatever. We get into comparing, which isn't a healthy thing to do. But that shame piece is really an essential feature that we see a lot, and it's not something that's healthy. And so we do use this phrase, we're good people who did bad things, just to try to make that distinction between the core essence of who we are versus what through the addiction we have done. And I think that's a really important piece to grab onto this, that we're not bad people, we're just not. And, occasionally we'll look carefully if clients are coming in, because sometimes we worry about a little antisocial, that is a different animal, right? Sex addicts, for the most part, they're narcissists, but they're not antisocial, which means that that's somebody who can't feel, who has no shame. And so it's really important, I think, to recognize shame when they're feeling it. And we really encourage clients to release it and give it away. Nobody's born with shame. Shame is taught to us by our caregivers, by bullies in the playground, by teachers, by the law, by the church. It comes at us from all sources. And kids aren't hardwired to refute it. If my father tells me, you're a piece of crap, you're never going to amount to anything, a kid believes that, right? They don't have the wiring to say, no, that's not right. And they grow up with that. And so those repeated messages are incredibly damaging for people. And those are the sources of shame. And so when we get into recovery, we need to give it away. Shame doesn't do well with daylight and truth. And so one of the things we do routinely in groups of seeking integrity, just on a daily basis for check-in, is there a secret or a lie you've told in the past 24 hours? But if not, why don't you share a secret from your past? So you can release some of the shame about that. And very often people say, well, I was going to carry this in my grave, and they release it. They tell the group, and oftentimes they shut down in shame. And we'll go around and say, make eye contact with everybody in the group. Are you judging me for that? And inevitably people, no, I'm not, because usually they've done the same thing themselves. So just by getting it out, releasing it is the healing method for that. And there's a lot of shame that needs to be released. It keeps coming up for a long time.
So I'm really glad he started the group. And we have another one starting September 1st. So there you can reach out, seekingintegrity.com to find that. And Dr. David's going to be doing a chemsex, the sex and combined chemicals, starting September 18th, I think, on seekingintegrity.com, or email me, Tami, Tami at seekingintegrity.com. But what I hear is good for you. You've been doing some work, and what I hear from him is he supposedly stopped, so abstinence for 1.5 years. And I think it's the worst spot to be in is to not have the tools of recovery and not have our maladaptive coping mechanism. So it's a horrible spot to be in. Shame is, and Kristen Snowden has done a bunch of webinars on this. We talk about shame all the time because it's a real sticking point for addicts. But it serves no purpose. Guilt can motivate me, guilt can help me do things better, but shame is the shame spiral that Dr. David was talking about. Brene Brown does bunches of work on reducing shame, but one of the things that he's going to learn in this group is he's not alone. So like Dr. David was saying, when you're in a group and they're talking about whatever they're talking about, it's going to be, oh, I did that too. Oh, I did that too. So it automatically helps. How we heal as addicts is bringing our gory stuff out and having it be seen and still being accepted. When Dr. David was talking about going to a group and being accepted, yeah, I can go into any 12-step, and these people, even if they don't know me and can't speak the same language, we all have that bond together. We have, even if the details don't align, like my story isn't the same as everybody else's, but we still know that the pain, the shame, the guilt, all of the stuff is still the same. So I'm sorry that he's taken so long, because I feel like he's kept himself stuck in the quicksand, for 1.5 years. But the good news is, he took a first step with that. So that's good. And there's homework, and the guys are super supportive. So and they ask, but one of the fastest ways to break through that shame is a 14-day program called Seeking Integrity Los Angeles.
Right,
so
exactly.
Okay, next question. Thank you. I just made a big decision, a second job and a new apartment. I feel sick about it. I feel like I made a decision to make myself feel better. I feel like a fool. Oh, that's shame. I feel like this is another situation where I'm messing up my life. My sponsor and therapist don't think I'm ready. Should I just pull out of everything? I feel like it's my purse that I need to.
I'm buying that purse.
Anyway.
Yeah.
Oh, yeah, it's my purse. Okay, I gotcha. Yeah, so, okay.
Right. So, yeah, first of all, being in that place of shame and remorse is not helpful, right? It just kind of keeps us stuck and keeps us in that place of judgment, that critical self-judgment that we talked about earlier, which is so harsh. We can be harsh with other people, but we're always harsher with ourselves. There's times to do things. I think, I don't know your decision-making process, but I think the way I'd recommend those kinds of things is really sharing your ideas with people that you trust, getting feedback, taking your time with it, not making it impulsive, just really doing it in a well thought out way. And I don't know if that's how it worked out or not, but I think I'm sorry you feel sick about it, and made that decision to make yourself feel better. I think that's where we go back to the intention, right? What am I trying to do with this? And we sometimes can bite off more than we can chew, that's for sure. But I would just, whatever situation you're in right now, I think if you keep talking to people, you mentioned your sponsor, your therapist, who have an opinion about this, maybe they can help you see, again, what's your intention? What are your options at this point? Nothing is ever irreversible and disastrous, right? It may cost you some money to get out of something, but your mental health is going to be more important than that. And so I know it's hard. I would put aside the shame and keep talking to people that you trust who can give you that information and help. I think that's the way to do it, for sure. I think we've all done this. Maybe sometimes too soon in recovery, we make big steps, big jumps, and sometimes we can handle it and sometimes we can't. But the most important thing is that you don't want to have this affect your recovery. I assume you're in recovery, and backfire in that way. That would be the worst possible outcome of all. Everything else is negotiable. So you really stick close to your advisors, be open, be willing to give feedback, and don't waste your precious energy on shame if you can help it. And that's a tall order, but that's what I recommend.
Yeah, like I honor that you brought it here,
Yeah,
I mean, great,
totally.
you're asking. So you have a therapist and a sponsor, that's fantastic. So I concur with Dr. David. It's like, here's where you're at right now. And writing out the pros and the cons and what are my options, like with the apartment, can you sublease it? I don't know. I don't know what, the particular details are. I don't know, if you take the second job, if you take the apartment, then, how are you going to manage your daily schedule? What does that mean? How do you protect your recovery? Can you get a roommate? I don't know, but really, you take a deep breath and ask for input by the people that that know you and can give you wise input. That's in recovery, we say first thought wrong, and it isn't always my first thought wrong. I've learned, but I also learned because I asked other people for their input, and I wasn't just asking other people till I got the answer that I wanted. I was
Right.
really working, because that that can be self-serving too. Oh, that one person agreed with me, 12 others didn't, but that one person did. So, and I didn't give them all the details, so it was really, I had to make sure that my intention for asking was I wanted to make the best decision for me, in the moment. But yeah, even with a second job and even with an apartment and all of those things, if you are moving into the apartment, enjoy it. If you're taking the second job, be the best employee you can possibly be. Do that with integrity and intention. So, but I think evaluate what's really going to work best for you. But nothing is forever.
Right, and just watch the judgment, the feeling like a fool and all that. That's again just not helpful. It's really not.
Yes.
I know
Yeah.
it's easier said than done, but if you can avoid that, that's really going to be beneficial.
Yeah. Yeah. And like I said, I literally struggled with that today, but it's a fleeting thought. And I know where that voice comes, it's a parental figure that, and, I go, oh, I love my dad, but it's my dad's voice because he was really harsh on himself. And I don't have to repeat that. I can go, oops, I'm human, and I have,
Right.
I have the ability to clean it up. So, do addicts suffer more than normal with tunnel vision, focusing intensely on a task at hand, but losing the bigger picture? It's the same with dissociation. Are there tools to deal with that?
Great question. So I think, addicts can certainly suffer from tunnel vision, but I think that we don't have the corner on the market. I think but some of these things overlap, right? I would think perfectionism is a big factor there. Also, just the way we look at attention, we can have different things called negativity bias, positivity bias, where we start to focus. It's like the glass half full versus the glass half empty. But all these ways of how we see the world and how we focus and what we pay attention to, all can be affected by addiction. And so I think it's a complicated thing, but addicts certainly are known for skewing the picture of what they see and that sense and the story they tell themselves about it. So I think that can be, but I don't think it's necessarily a domain necessarily totally of addicts, because like I say, perfectionism, certain kinds of attention issues, ADHD, in fact, people can overcompensate and try to do that. So there's many different ways to do it. I think it's slightly different than dissociation to me. It's more where we're putting our attention and focus as opposed to kind of checking out. I think they're two different kind of mental phenomena, just to answer it really quickly.
Well, and I think with addiction, it's a easy setup because we get compelled to go do our acting out no matter what, despite the consequences. So that feels a little tunnel vision-ish. There's one comment in the chat that I want to ask. and it goes back to the, I think it was tied to the Tetra question. How long years will addict need to do this distraction? And need is to me like a challenging word, because ultimately we don't need to do these things. So so what are your thoughts?
I think over time the intensity of those triggers and cravings do fade, and so I think that conscious like distraction also fades. It becomes less necessary. But I never want to kind of retire that technique, because there are moments, even well into recovery, where we can all get triggered. And I think we really need to remember that tool as a useful way to redirect, and I'll say redirect our attention to something healthier, as opposed to just kind of, it makes it sound so cheap if we're just distracting. It's like a trick, but we're really just redirecting where we're putting our attention, and we're not feeding those addictive flames when we're doing it.
Well, and hopefully and I have a whole bunch of different techniques. Like for me, going for a walk or a run, it isn't just like, oh, I feel funny, bad, good, whatever, so I'm going to go do a game. No, I'm going to phone a friend. I'm going to get out of myself. And I think the more that it's done in a healthy connection way, rather than just in a, I'm going to focus in.
Exactly.
Is better. So hopefully the shift is to how can I go be of service to another? How can I, do something that, is a productive, positive thing, not just, I've just spent X amount of time head down, with me. So
exactly.
We are out of time. Thank you, Dr. David, and thank you for everyone who joined in. Great questions. So keep coming back. Scott will be back next week on this one. I'll be on with Dr. Rob on Monday night, and I'm subbing in on the partner groups next week quite a bit because a lot of people are out of town. So I'll be online a bit more. So thanks, everybody.
You, always fun. Thank you.
Bye-bye.